thanks to the World Health Organization for hosting us today. This panel is being brought to you by the Climate Change Media Partnership. For those of you not familiar with us, we've been bringing journalists from low and middle income countries to the climate COPs since 2007. We're very pleased to have brought another 20 journalists who are doing excellent work here this year as well. The CCMP, we are a collaboration currently between the Stanley Center for Peace and Security and Internews, the Global Media Development Organization. Internews has many programs working on climate change, journalism, media, information ecosystems. The two prominent ones here today are the Health Journalism Network and the Earth Journalism Network, which together support tens of thousands of journalists to improve their coverage of climate change, health, and the environment. So it's really a team of experts we've got here today. And I will just say before turning over the mic to our wonderful panel, we are really dedicated to improving coverage, not just of the health impacts of climate change, but of all kinds of One Health issues that combine reporting on human health, animal health, and ecosystem health. This is a really underreported topic, and we've been working for many years now to improve coverage, and this is, I think, a great step in the right direction. We've got a lot more work to do, but I'm going to turn it over now to Internews' Senior Health Advisor, Ida Just, who's going to be our moderator today.
Thank you so much, James, and hello, everybody. Yes, thanks for joining us online and joining us here at the Health Pavilion. It's true, James, I think for 10 years or so now, the two of us, so sorry about that. The two of us and other colleagues at Internews have been really advocating for this story, which we're discussing today. When climate is a health story, when is climate a health story? Now, and has been for many years, and will continue to be for perhaps as long as we can imagine time. But how do we tell that story? That's what we're going to ask our panelists today. I'm Ida Just, Senior Health Media Advisor at Internews. I'm really thrilled to have journalists here from around the world attending the COP, of course, but also helping us all navigate how the story will be told. I wanted to tell the online audience that you will be able to ask questions. I believe you would need to scan the QR code available. Is that correct? Towards the end of the discussion. We hope to have 10 to 15 minutes available for discussion, and we really look forward to your participation. Thank you. Now, climate is a health story right now, we say. At this COP, I mean, it's almost impossible to ignore the significance that this nexus between climate and health has been given. It's the first health day at a COP. The largest contingent of health ministers from around the world will be here today during this 2-week period, some of them. And also just from the pavilion here and other centers at COP, we can see many subjects ranging from maternal health impacts, mental health impacts, both direct and indirect impacts of climate calamities, short-term and long-term impacts being highlighted. The journalists with me today have been covering that story and have been giving thought to how to best cover that story. So I'm going to start with Chiamaka. Chiamaka Okafor is reporting for Premium Times in Nigeria. She has been with the Oxford Climate Journalism Network, and she's also here courtesy of the Climate Change Media Partnership, which James mentioned, and of course the Earth Journalism Network. So, I mean, to us here, this may seem a really obvious story. You've already told us how people in Nigeria are experiencing this impact as a daily challenge. Tell us more about it.
Yeah, so the issue in Nigeria is, hi everyone, thank you for joining us. So the issue in Nigeria is really very clear, but maybe not so clear. But I'd like to do an analogy with the issue of malaria in Nigeria. Malaria is endemic in Africa, so malaria is like everyday news. But what we don't see, or what we seem not to see clearly, is the fact that the rising cases of malaria are not business as usual. And interestingly, the WHO malaria report that was published yesterday made that very clear. So this is not me just making permutation or guesswork. The report says it clearly that countries like Nigeria, a number of them, but of course Nigeria is of interest to me, Pakistan as well, and that of Pakistan, you could find a correlation between Pakistan and Nigeria for last year, for instance, because there was an unprecedented number of flood. And that of Pakistan is very interesting because it was fivefold compared to the numbers in 2001. Now, Pakistan is not in Africa, so we can't make the argument, well, I'm not a scientist, but I don't think the argument of malaria being endemic can be made in that part of the world. Of course, they have other issues, but it's really endemic in Africa. What does that show? Now, it shows that the longevity of these anopheles or these parasites is increasing, and they can now exist in different environments because climate change, increased rainfall, heat wave, and all the other forms of presentation that climate change take, it's making it easier for them to live longer. So while the human lifespan is decreasing, that of this organism, or organisms rather, are increasing. So for Nigeria, you begin to hear about cases or situations, what we call drug-resistant malaria. Perhaps, we haven't paid more attention to understanding why that is now a case. Why can't Artemether no longer cater to malaria or solve malaria in that sense? So you have to take the tablets and combine them with injections and return to take another dose of tablet before you are fine. But even after that whole process, if you're tested, malaria is still found in your system. But say, oh, that's the one you can live with because it's already in your system. But the point I'm trying to make is that over time, the cases of malaria in Nigeria, Africa, is increasing. And we tend not to see what is just right there before our eyes, the correlation between the changing climate, human activities, or whatever you like to put it as, how it's affecting our day-to-day lives and how we live. So that is a classical example.
I think it's worth reminding ourselves that I think very long ago when An Inconvenient Truth of Al Gore was first published, that's one of the very potent cases that was made, that malaria will simply occur in more high-lying areas. So you're saying it's endemic in Africa, but of course not everywhere, but it's moving to different zones of the continent. Could you talk a little bit about other examples? We associate Nigeria with oil production.
Yeah. Interestingly, we had Guterres talk about how to phase out fossil fuel, and it was very interesting to me. So Nigeria is an oil-producing state, and oil is the mainstay of our economy, so it's more like without oil, we're done. And so when I heard Guterres made that proclamation or declaration or plea this morning, it was interesting because how then do countries like mine survive? But it's also interesting for us to move if we really want to continue existing in this part of the world. Probably we'll have to move to Jupiter, but back to the point on oil. I'm sure a couple of us are familiar with the whole shale exploration of oil in different parts of the world. But that of Nigeria also is a big story. And then you hear people say, oh, is oil a curse or a blessing for countries like Nigeria? And a little backstory. The case of oil in Nigeria, it has a lot of background health implication for people who live in areas where oil is exploited. But I had a personal encounter with it that led me to doing a story or going to gossip, in quotes, about it. And so I went home last year for the Christmas holiday. I live in the north, and my family lives in the southern part of Nigeria. And so I went back home, and they live in Rivers State. Rivers State is one of the states in south Nigeria that produces oil. And so I got back home. In the northern Nigeria, there's a lot of dust, so that's I'm used to that. But in the southern part, there's a lot of rain, so it's, dust is not a big issue. And I went back home in the morning. It was a Saturday. I hadn't gone out. I just put my feet down. And then I was inhaling stuff. It felt like dust. And I had to ask my kid sister, where's the dust coming from? This is not the north. And then she cackles. Why are you laughing? What's funny? I said, oh, it's not dust, it's soot. And the way she said it with so much, reckless abandon, you should be used to this girl, so don't complain. And what do you mean by soot? And then she gives me a white napkin and she say, wipe your nostrils and then you see what soot is. Remember, I hadn't gone out, I was still in the house. And then I wiped and it was all black. I don't work in in a fuel company or something, or in a factory, so that's something I shouldn't be seeing, right? And then I started asking questions. Say, oh, it suits these boys that do illegal refining, blah blah blah, and you can't go there because it's illegal. When people are doing illegal stuff, they don't want you around them, so you can't go there. And then I set out to say, okay, I'm going to do the story. I'd gotten to the community, but of course, basic journalism skills, you have to do your due diligence, right? Ask questions about where you're going to, and I got to the place, and I got to the spots where this illegal refining was going on. But when I got there, and I informed my editor that I was going, I didn't say I was there already, and I said I was going, and he said you can't go there because you know, of course, what's happening there. Interestingly, there's a UNEP project called Clean Up Ogoni in that part. That's the Ogoni part where this whole mess is happening. But on getting in, there, you see tractors and UNEP signboards saying that this is happening. But why am I saying something that is not happening? Now, I cannot authoritatively say that it's not happening, but I saw a damaged farm. Now, this is where the boys do the exploiting and everything. This has led to increased respiratory diseases or infections in Rivers State. How do I know this? I spoke to pulmonologists, I spoke to respiratory infection patients, like people who have asthma. And they tell you that the number of times I have attacks have increased compared to before. And the pulmonologist looks at me and smiles and say, oh, since 2014, 2016, we've had to receive double the number of patients we used to receive because of respiratory challenges. There's a research as well. I'm sure Jody is going to talk about the research aspect.
Yeah, I think let's pick up on that because you mentioned the words gossip or hearsay, the anecdote in a sense, or the very journalistic activity of going into a community and trying to discover something. But you said, how do we know that? And that's really such a critical part of telling this story because some things seem instinctively likely to us. But perhaps there's a real shortage of data still. And I know Joydeep has an example that's really similar. How can we corroborate this? How can, the signal that we see, how can we get to data so that this can be reported with confidence? Joydeep Gupta is joining us and has a very important perspective from India, where he's the editor-at-large of The Third Pole. He's also an experienced media trainer with the Earth Journalism Network. So, both in your own reporting and guiding other journalists, you've come across this issue of what to do when the data doesn't seem to be there.
Right, yeah. Thanks, Ida, for that, and Chiamaka. Hello, everybody. Yes, I think I'm in this panel to complain. And I'm really hoping that there are doctors and health administrators here and online so that my complaints heard, okay? Because we get stories, and we do stories, and we want to do more stories on the health impacts of climate change. And I'll explain the problem with two examples. One is that throughout the tropics, and definitely I know this from personal experience of guiding reporters in Bangladesh and India, in a belt about 5 kilometers wide from all coastlines, people who cannot afford to buy bottled water are drinking saltier water. They're cooking with saltier water. The result is that the number of high blood pressure cases is going up massively. Preeclampsia is going up massively. We are seeing this on the ground. We are wanting to do these stories. Our problem is we are not finding epidemiological data that can give me the number of cases 10 years back, 15 years back, 5 years back, and today. So that is my appeal to the epidemiologists, the MPH experts, that this is what we need in order to do credible stories on the health impacts. We know that there are health impacts. We are getting loads of anecdotal evidence. I'll give you another example. And this led to a major issue last year in northern India, in the state of Uttar Pradesh. The temperature was for about a week, went to 47, 48 degrees Celsius in the summer. And there were, in one small hospital, in one small town, within 48 hours, there were 39 deaths. And so the local reporters rushed there and asked the medical superintendent what happened. And the medical superintendent said on record that these are victims of heat stroke. So they reported that. Within a day, this was denied by the government, by the health ministry, saying that heat stroke cannot cause death. These people had other problems. They're elderly, and that's why they died. And then we started to figure out on what basis was the government saying what it was saying. And we realized that there is a fundamental problem here, that heat stroke is not officially accepted as a cause of death. If a doctor writes heat stroke as a cause of death in the death certificate, the insurance company does not pay. And so even when the doctor knows very well that this one person has died of a heat stroke, he cannot write that as the cause of death. He writes something inane like cardiac arrest or something like that. So this is a fundamental problem that we are facing. And this is something that really somebody like, I think only WHO can push countries to have heat stroke accepted as a cause of mortality and morbidity. And that is what I wanted to bring to this table to start with.
Thank you. That's such an important point, because I think, again, we can all experience, many of us have experienced it anecdotally where we live. I'd like to go to Ana Amaral, who writes for Folha de Sao Paulo in Brazil, where you have also told these stories and have found that in some ways there are new ways that the story can be told. Can you tell us more about it?
Yeah, thank you, Ida. And thank you very much for your complaints. Alice took notes. She's the highest authority here, so I believe this is going to change. I would like to take a step back into the epistemology of journalism, because I understand that the reason we have this question now about when climate is a health story has the same reason why we have not been able to give the alerts, to give the message about how urgent and important the climate crisis are, because we have not been able to connect the dots properly between the planetary health and the human health. And I've been interviewing many indigenous leaders in Brazil, and it's still such a deep perspective they have on our relationship with nature that I need to go through a master course in order to start to understand their perspective. So I went to the Holistic Science course at Schumacher College, which is an English school in South England, a very unique place. And at the beginning of the course, I heard the phrase that comes from the indigenous perspective, which is, for the indigenous people, the river is the continuation of their own blood, of their own veins. And for me, at that time, it was 2014, it sounded like a beautiful poetry. I took the whole course to start to understand that was not just poetry, it was also a literal relationship. And us, as we have this Western Cartesian education, which for nature would sound very arrogant, we believe that we are clearly separated from the river, separated from the ecosystem. And this view is very clear here in Dubai. Like, we are in a city that was, it is a very artificial landscape in which, in a hostile summer, then can live 24 hours under air conditioning. And I hope they don't believe this is climate adaptation, because it's not. But we do believe we can build a bubble and that we have surpassed nature, that we have evolved to outside nature. And when we are able to get this indigenous perspective, we realize that this connection with the river is literal, because if you are drinking the water that comes from the river, so of course it's obvious this water is literally becoming our blood, it's becoming part of our body. And we only realize that when you have a disease, like a disease coming from the contamination of water, for instance, then we realize this link. Then we realize we're not invulnerable, or to use a vocabulary from health, we are not immune. And for the indigenous people, this is so clear that, for instance, I was interviewing Sinea do Vale, who is a leadership from Wapixana people in the Amazon region of Brazil. And she is, by the way, she was nominated yesterday, the co-president of the Indigenous Caucus here at COP28. And she was telling me that climate change is affecting their life plans. And they build collectively their life plans. And I was trying to understand what that meant. And I asked, is this kind of territorial planning? Because for us, we do this territorial planning, right? Like we can build here, we're going to conserve here. And she said, no, not territory, it's our life plan. Because for them, it's very clear how their land, their territory is an extension of their bodies. And now in the Amazon region, they're suffering from an extreme drought. I don't know if you have followed it, but well, the rivers have particularly disappeared, and they are without water, without food, and well, the only water they have is contaminated now because of the death of the animals. So they are in a very extreme situation there, but they didn't need it to go to this extreme situation to realize this link, as we need to go. So what I'd like to suggest as an approach is something that I've been trying to follow up with my stories, is to investigate this link before the disaster. Because I don't want to be the reporter after the disaster. This is a pact I made to myself. Like I cannot be just like reporting after disasters. I have to be more useful than that. And I think we are more useful when we are able to go prior to the disaster.
And I think we are in disaster in many parts of the world. So we don't have the luxury of before disaster in many places because, you know, the impacts, the health impacts have, you know, we're not really able to mitigate that in all of the examples that you've mentioned. So I'd like to ask you, Dr. Alice Bell. Alice Bell heads up policy, climate and health at the Wellcome Trust. And I wanted to ask you sort of what that means really, because some of the examples we've heard about rely on better national policies, and of course global policy approaches. So what do you do? I think wanted to start off with that. What does it mean to be heading policy, climate and health?
We have the reason I was taking notes, particularly with you, was that I thought that challenge was in many ways to research funders like Wellcome. Wellcome is a major research funder, and even though our climate program is one of our smaller ones, we are still the global funder of climate and health research. And we are trying to fill those gaps that you're talking to, and I think that challenge is one that I need to write down and remember, and but remind other people. I go to these events on climate and health research, and I think we fund you, and I don't want that. I need to be able to go to those events, and there needs to be 20 times as many people. They need to be much more diverse. They can't just be from cities called Cambridge. And they need also to have a diversity of funders, because it can't just be Wellcome funding this. You know, it's not just up for philanthropies; it's up to lots of different philanthropies, but also major governments and people around the world. And it's vital that research is global, and that the people who are most affected by climate change have the research capacities, because science is such a powerful tool to help us understand the problem and therefore be able to build local solutions. And it is also, as we're sitting in a journalism panel, it is the basis of a lot of the journalism. So I see that problem too, and that's one of the things that we're trying to fix with our climate program at Wellcome. And then I'm the head of policy for the program, so we do things like come to COP and think about national policies. Think about how we need to change how we do health and how health is regulated, maybe speaking a bit to the question of of death certificates, but all sorts of other different areas. It's quite striking how ill-prepared in some places the health sector is. That we're acting as if we're planning for health. We're thinking about the health challenges, maternal and child health, disease eradication, all sorts of different areas, and imagining we're going to do this by 2030 or 2040. And the world is not like that. We're acting as if health is happening with static temperatures, and we haven't been living in static temperatures for, a very, very, very long time, long before the WHO was even set up. So that's sort of what I do. Do you want me to talk a bit more about some of the...
I was really interested in the policy aspect because, of course, the examples mentioned here talks about, an absence of policy or perhaps enforcement of policy in some cases.
I mean, yeah, and there are... I think there are similar challenges in the policy area as there are in some of the bits of journalism. So you sometimes think about the problem of silos where health journalists aren't so sure about the climate or climatists aren't so sure about health. I actually think in that particular example, health journalists and environment journalists have very similar skill sets that you need for this challenge, which is to be able to navigate research and to understand the politics of that research and to understand the politics around that. And some of the politics around having the health beat are not entirely dissimilar, the patterning of some of the politics of the environment beat. So actually, if you've got two areas that have to combine, I think they're ones that are quite, they can understand each other quite well. And it's surprising, actually, how frequently I'm starting to find people who have a specialism in both, because I think people recognise how quickly they can pick that up and how necessary it is. But we see that same silo problem in policy probably more expressed in that health ministers are saying, oh, I can't do that. That's for the transport minister or the energy minister or the environment minister. And similarly, the environment ministers are, well, that's a health issue. And then it just goes by the wayside. And we do need more hybrid people in policy who understand both areas, who have jobs and are situated in institutions in ways that they can feed into both areas. We need health advisors to different ministries that enact climate change policy. One of the reasons we're here at COP, and is the sort of driving force of a lot of what we do in the policy work at Wellcome, is that we believe that decisions made about climate have to be informed by health, because so much decision making about climate is just weighing up greenhouse gas emissions on one side and money on the other. And if we make decisions that might work perfectly for those two things, but you're missing out the human element of it, and you're potentially putting people at risk. And when you're exposing to people to risk, environmental risk, often it is the people who are already the most marginalised in society who are going to be most exposed. And so it's vital that when we're thinking about, are we going to make a decision about CCS or where we place this solar farm or how fast we quit fossil fuels, or all the different decisions that happen, how are we ensure we're doing that in a health-informed way? And sometimes that will be helping, I hope, speed up some forms of climate action. Sometimes it will be saying we actually need to do that in a different way. This thing might seem like good climate action, but it's not healthy. Yeah. And it's really, really vital that all of our climate decisions are based in health. And so I think journalism is going to be part of that, because we need, I think journalists are already calling this out by saying, look, this looks like a good climate policy, but is it healthy?
Correct. Yeah, I mean, kudos to journalists for picking up, sort of ahead of the game, if you like, of researchers and policymakers in some cases. I want to encourage all journalists to continue doing that. It's encouraging what you see, which is what we also see as these sort of hybrid or nexus journalists emerging, but still there are many areas we still all need to learn about. You can become a sort of fixed in a health beat type of journalist, and the civil society experts, the science journalists, science journals to refer to. You may know you may have your favorite contacts, but we need new favorite contacts. Dr. Bell actually also has a PhD in science communication, and she's written 2 books and has also written as a journalist. So I want to ask you also, how is this climate health nexus story, easier and more difficult than, general science communication?
I think I touched a bit on the fact that I think that there is an easiness to it in that those beats aren't that dissimilar and they can learn from each other. Right. I also think that those are 2 beats that are quite used to absorbing new disciplines. They're not areas that are very insular, that are just, I only talk to my contacts about these specific issues. They're both ones that have absorbed lots of different disciplines and are aware of the need to be very interdisciplinary. They're both interdisciplinary research fields, and that is reflected in the journalism as well. So I think they're porous enough, and I think they're 2 areas that, if you're going to work together, those 2 are going to work quite well. There are also, I often think about climate comms issues that we've spent decades trying to engage the public with these abstract ideas of kilograms or gigatons of carbon dioxide, and measures on the temperature scale. Like, again, we're going through another round of should we talk about 1.5? What does that mean? And then we have all the discussions about the realism of 1.5 and the politics of 1.5, and yet most people have no idea what you're even talking about. In fact, lots of climate people don't even really know what we're talking about when we talk about 1.5 or 2 or 3 or whatever, these different numbers. And we spend all this time trying to engage people with these abstract temperature scale issues or weight of greenhouse gases, and we could be talking about people's lives. And actually, if we go straight to that, people get it. And so I think when we start bringing health into climate journalism, it opens up so many different ways of just having a more engaging story. There's lots of people in the climate and health space like to use the phrase that health is the human face of climate change. And I think that really speaks to the journalist in me, and that, like, it gets me to tell a story. Because, I just said the research is a core part of it, but so are human stories. And, you were talking about those people that you've met, all of you had stories of people, and that's the core of it, and those stories are there. We've certainly found that at Welcome, where we've been sort of engaging, not just news reporting, but in cultural spaces, storytelling, fiction storytelling, dramas on television, for example. And, there's this dream for climate comms that you'll be on mainstream television, that you'll be in the soap, And for years, I remember it was when I was running a comms program, people were like, you'll know you've been succeeded when you're on this particular mainstream British drama. And nobody could get climate into it because it's really abstract. Nobody wants to talk about 1.5 about these things. But if you bring health, then it's a story because someone's breathing it, they're feeling it, they're literally tasting it sometimes. It's something that it's very evocative. So I think there's huge amounts of space for it there.
I mean, it's a story just waiting to be told. Anna, you had a thought about the 1.5 issue, actually.
Yeah, thank you. I just wanted to add on that because it's very tricky, because a good narrative, a good story, is the story that flows. So it's not just the health story or the climate story or a bridge between them. This interdisciplinary is still like this, recognizing a division and trying to make a bridge in between this division. And what a complexity, the complexity approach to that would suggest is that reality is at once. Climate is environmental, social, and communicative at once. It's a Bruno Latour's phrase, a French eco-philosopher who suggests this approach. So it is still tricky to us as journalists to make the right questions in this very complex narrative, which is local and global at the same time. And something that I started to do in Brazil every time I talk about the 1.5, keeping 1.5 alive, as we repeat here at the time, is try to translate that to the regional reality. So 1.5 is like a global average that doesn't mean anything in any territory. So when you go to the territory, in the northeast of Brazil, for instance, is one of our most vulnerable regions because it's historically suffering with droughts. And now it's a semi-arid region, which is becoming an arid region. It's becoming a desert. And for them, 1.5 means plus 8 degrees Celsius. So it's a complete disaster already, even though it's still a safe place to go, but it's a complete disaster. So when you make this translation, not from local to global, but the opposite now, from global to local, I think we can connect the dots between what people is feeling at their skins, at their bodies, and what's happening globally. Because we also have the risk of keeping this story isolated, no? Every time, this was like a heat wave. It can be read as isolated events that keeps repeating themselves.
Yeah.
So
yeah, global, local. I mean, I'd like to hear from you, Chiamaka, about that idea. Because, I mean, still, it just seems so appealing. It seems like we should just be running and starting to write the story. But you did mention that there are things that journalists would need to specifically learn about.
Yeah,
First.
so I like the point that you made about, the whole abstraction that climate change exists in. And so you say, heat wave, what is heat wave? What's 1.5? I didn't know what 1.5 was. And I'm in the privileged 1% called journalists who are supposed to know everything, right? Or a little about everything. And I didn't know what 1.5 was. And so, interestingly, my foray into health and health journalism was just out of curiosity. So I'm the typical person who will go to the hospital, and when a doctor says, this, can you please explain what that is? And I always say, oh, please, dummy 101, that's what I want you to do. And that starts to send a message that if you, an educated, privileged, whatever you like to describe yourself as, does not understand this, how much more people in disadvantaged areas, how much indigenous people, like Anna mentioned. And so you need to be able to communicate in the most basic way. So keep all your vocabulary and your jargons aside and come down to what people can relate to. And Anna said, it has to be something I understand, right? And so when the people in the Amazonia say, oh, the river is an extension of our blood, so when you do an analogy with that, they understand that polluting this river is you hurting yourself. So you cannot do that. But then a lot of times we journalists are lost in research papers. We just want to take out that very nice, flowery commentary that the scientists has put there, and we lift it and dump it in the report. But you're not writing a science paper, right? You need to translate it for your poor audience or not so poor audience to understand. And so the point about going back to take a course again, Anna took that right out of me. And so in 2020, when COVID happened, everyone became a health reporter, whether or not you knew what you were doing, whether or not you were an electronics reporter, you had to become a health reporter. But it was important for me because my ideology is that you cannot report what you don't understand. And so you always have to consistently report from a point of knowing. You need knowledge. So if I don't know how 1 + 1 is 2, how do I explain to you or convince you to believe that 1 + 1 is 2? And so I went back to take a course because I didn't understand what things like false positive was, or this virus is in the air, all the things we said about COVID. And I didn't understand that, there's no medication for COVID, but people were being treated for COVID. How was that happening? So I needed to take courses in the sciences. Apologies, I'm a social science student, so I have no background whatsoever. The only science background I had was the biology I took in high school or secondary school. So it's like the respiratory system, just the basic. And it wasn't enough for me to do such high-level science reporting because that was what COVID did to everyone. So oftentimes you see people just copying and pasting press releases without any context, any background, or helping people understand. So the point I'm trying to make is the importance of capacity building. And you don't have to wait for someone to give that to you because ultimately you do it for yourself. Nobody's going to take a straw and suck out the knowledge in your brain when you get it. Yeah. It remains with you until you choose not to. Well, maybe you get Alzheimer's or amnesia or something, but it's going to be yours for eternity or for as long as you last here. Now, if I did not take the courses I took, I went to take a course in epidemiology and writing in science. Writing in science was very important for me because it was science I was trying to interpret. So it went through how you needed to break it down to the most basic. It's not a walk in the park. So it doesn't sound like, oh, she's saying very nice things and it looks so easy. It's not, especially when you are like me, who has no science background, and you have to move. You surely want to compare this to transitioning or moving to a new city and having to adapt or adjust to the realities of wherever you're moving to. It's not easy, but it's worth doing. If you want people to understand the implications of the actions they are taking, you have to be able to help them understand what they are doing.
Yeah, I think you're just saying you've got to make the effort. And I think we understand why we need to make the effort because it's such a serious issue. I think you said also, Tiamaka, how would you convince people? And I think definitely in the health world, we feel as health journalists that we're closely aligned or somehow have to think about behavior change. I think you took the Let's Talk Vaccines course, and as a health journalist during COVID-19, many of the journalists who became journalists felt like, is it my role to convince people to be vaccinated? Yes, if you're a serious health journalist, but at the same time, journalism is about independence. So I wanted to ask you, Joydeep, with climate and the climate story having been around for decades, of course, and not really having achieved what we had all hoped it would achieve, how is this behavior change going to be different with this Nexus story, if you perhaps believe it might be?
Yes, well, as Dr. Bell pointed out, putting the human face on climate change, and that's journalism 101, right? Putting that is, to my mind, the way to go. And so there are some very good things that are happening, and some small bridges that need to be built to make this really move, okay? For one thing, all serious science, health, environment journalists get in their mailboxes every morning PLOS ONE or UREC alert or both, which is essentially they are seeing what the main science papers that PLOS ONE and UREC alert editors are selecting from the thousands of academic papers, which they think is of public interest. I have been finding that they are not concentrating on climate and health nexus. You get very few of them. But that is not to say that this is not happening. Epidemiologists are studying. It's just that we are not getting to know what they're studying. I'll go back to that example of higher blood pressure along the coast. So we were doing a media training webinar because it was COVID. We couldn't do it face-to-face webinar. And your colleague, Jaya Sridhar, was speaking to journalists on this issue. And from the questions, she realized that journalists were also looking for academic papers. And at the end of a half an hour presentation, she gave links to 7 papers. And within a month, the coverage just jumped because now everybody had specific peer-reviewed academic papers to use to make their anecdotal stories credible. And so they put a human face and then they have stuff to back it up, to make it credible. So my specific request to WHO, to Wellcome Trust, to whoever wants to do it, is to have this repository of peer-reviewed academic papers that are looking at the climate health nexus and to make that database available to journalists.
So I think we've heard tell the human story, it's in our veins, and we also have to have data. The research has to produce data, and journalists also have to know where to find the data and know how to report on it. And then hopefully get to behavior change, I guess. I mean, ultimately, that would be a fantastic goal to achieve, and journalists have a role to play, among others, of course. So I hope that we have questions from the online audience, and that we can relay them. That would be wonderful. Oh, in the room first. Thank you.
I'm Dr. Mary Rice. I'm a pulmonologist in Boston, and I'm an environmental health researcher. Jaideep Gupta, thank you so much for pointing out the importance of good science. And I wanted to follow up on your story about the heat stroke deaths in India and how the hospital came back and said, oh, those deaths were from other causes. And that points out to me that there's this additional complexity of the science that's hard to communicate, and I'd love for input from you and others on this panel, which is that most deaths from heat waves are not due to heat stroke, even if you could document that. We see from the data that there are many excess deaths from respiratory causes, from cardiovascular causes, from sepsis, and that can be really hard to explain. And it's absolutely true that people with existing health conditions are more likely to die from their existing health conditions when it's hot outside. So how do we communicate that to the public?
So I think...
Yeah, please do.
Okay. So yes, I do think doctors need to get a bit braver than they are. So, because they know the underlying causes. Yes, I completely agree with you that very often heat stroke deaths are actually, especially if they have not managed to get to the hospital, are due to dehydration. If they get to the hospital, they get the drip, then they're no longer dehydrated. But otherwise, dehydration can cause death. So, and then that will be or pulmonary cases. So yes, in the death certificate, that's what they're writing. But if they're not writing what sparked this, what sparked this crisis, what got this person into this state and usually into a hospital, then how do we prove that a link between rising temperature and deaths? If I take the temperature over the years and take the number of deaths over the years in the same week of May, say midsummer in India, okay? Then the two graphs will more or less superimpose. The two lines will more or less superimpose. And I can show that, and we did that. But it's still not a final proof from the epidemiological point of view. But at the moment, that's the best we can do. So we are looking for better proof.
I'd like to hear from Dr. Bell on that too. Yes, thank you. Thank you.
I agree it's really important, but at the same time, we have to be really careful that we don't over-attribute climate change. And that's not just for scientific credibility, although it's that too. It's because it can let people off the hook for other things. Because those people have died not just because of the heat wave, but because there isn't decent adaptation in place. We do not have universal health coverage. One of the things the WHO was set up to do in the 1940s was to give universal health coverage, and we know it's in one of the it's in the IPCC report that one of the things that we can do to protect as an adaptation strategy is just increase access to healthcare. And it's really important that we don't let the global and national, I'm here as a policy person, stakeholders off the hook for that sort of stuff. And it also relates to another thing that I think is really important in terms of the storytelling. It's not just this attribution question, which is vital, but also that I think health journalists and environment journalists should be helping people understand some of the public health things that they can do. So you were talking about behavior change. Some of that behavior change will be about stopping more warming. It's about understanding why changing your diet or how you move around is important. But it's also about how you can protect yourself. And there are so many parts of the world where we need better public health communications for a warming world. And that is part of the heat story as well. That's not, by saying this, I also don't mean to diminish any of the attribution stuff. It's one of these, it's a bit like adaptation, mitigation. You don't want one to overshadow the other. We need both. But that part of the story is really vital.
Thank you.
Yeah.
And I wanted to actually just also say, Doctor, I mean, I'm so glad you raised this because I think while the attribution question is definitely something we must pay attention to, we do have comparisons that we can make. Comparisons with HIV, comparisons with COVID-19. So the one, depleting the immune system and the other being a disease of general, what's the word I'm looking for? Excuse me? Yes. Inflammatory disease is the word I'm looking for. And so therefore, it's difficult for people to, we've seen this with both HIV and COVID-19, that people feel, well, how can there be more than one symptom? And perhaps not really but the nuance of what you've highlighted is very important for journalists to be able to kind of communicate, to translate the science of when attribution is relevant and when not. Yeah. Yes, please do.
You want to go? Just a quick guess. I would like to share. I guess that's the question about this attribution of climate change. You make us reveal our questions, because when you remember some years ago, the scientists were struggling to deal with the attribution of extreme climate events to climate change itself. So for many years, we were asking, is this flooding related to climate change or not? We cannot say, it's not a direct relation. And then they found the right question on that, which is not, is this directly related to climate change, but it's rather how climate change is increasing the frequency, increasing the intensity of, so it's a different question. Yeah. So maybe what we're living now is this moment of finding the right question about how to connect those dots.
Yeah.
Thank you. That's a great point. Finding the right questions, both for researchers and journalists, a key skill, isn't it? Yeah. Yes. Thank you. Another question
right here, but before I hand it to you, I just want to remind the audience viewing the live stream to look at the QR code on your screen, and you can submit questions that way.
Here you
Thank you. My name is Sally Dickerman. I do research about the impact of the climate crisis on sexual and reproductive health and rights. And so my question is related to non-traditional forms of evidence, evidence coming from indigenous communities, qualitative evidence, right? And I wanted to know what your thoughts are on the role of qualitative evidence in journalism as well, because there is often a bias towards quantitative forms of research, and as many have been pointing out, the linkages, the pathways are not always that clear, the causal pathways. And so at least in sexual and reproductive health, a lot of it is because people's lives are not siloed, neither is the impact of climate change on their health. And we can't see that any better than the effects of the climate crisis on people's bodily autonomy, their ability to access sexual and reproductive health services. And so I just wanted to hear, what are your thoughts on how we can better harness indigenous forms of knowledge and qualitative evidence?
Who would like to take that? Joydeep? Yeah.
Okay, it's an important question, and in the sense that one thing I can tell you, that in general publications or general television, editors hate qualitative data. They want numbers, because they want to prove what they're saying to their audience in a way that the audience cannot come back and say, this is just anecdotal. So, but yeah, there are editors, I'm one, who are working for maybe specialized publications who are happy to take qualitative data. But yeah, numbers are important. And that actually is also my response to the earlier question, that numbers are important. We know that there were people dying of pulmonary diseases 20 years ago. That's why I keep asking for epidemiological studies, because I want the baseline data. I want to see the extra deaths. I want to see the trend. That's the only way I can compare.
But I do think we need to acknowledge the role of narrative journalism, which is an emerging trend where stories have validity, and stories over time have validity, and the same publication can at some point also carry the data without saying that the story is not valid because it's somebody's lived experience.
Just to add to
Yes,
what
yeah.
you said. So the idea of sexual reproductive health is something I'm very interested in. And I like the point you made about access, how climate change impedes access. And so the place of qualitative data. In the absence of quantitative, qualitative ultimately becomes data because those are numbers. Those people who don't get access because of flooding or some cyclone or something, they become the numbers. So 2 women at this time, maybe May 2022. And so for someone who ultimately wants to now find numbers and do quantitative, they pick these reports that are originally qualitative and then make them quantitative. It probably might not follow the typical empirical pattern, but I think it's empirical too, because research methodology is quantitative and qualitative. So yeah, so that works. So I don't think, just to deviate a little from what Joydeep said about, editors wanting numbers. Numbers are very beautiful, 100 people, it just sends the message. But sometimes 100 is just a number. Until you put a face to it, then it makes sense. And which is what the doctor said about the human face of the whole climate change story. So the lack of numbers shouldn't be an impediment to, telling the stories of how they happen, because the people, the faces, are actually the data you're looking for. So sometimes you have to create the data yourself.
Thank you so much. Chiamaka, I see a question there.
Hi, my name is Lalita Sirapaneni. I'm a physician based in Minnesota. I had a question, it's a 2-part question about how we can report the role of the fossil fuel industry in the climate crisis. And I ask because I often talk to media about, wildfire smoke or extreme heat health impacts. And when I do want to mention that the role of fossil fuels, it often gets, I get told that, well, this is not that story. You know, this is a climate story. And so how do we make sure we connect those dots for the listeners, for the readers, and how do we motivate them to action? Because oftentimes I want to say, well, in addition to, you know, not breathing the polluted air, you also need to be talking to your politicians and advocate for cleaner policies. And I might hear from the reporter that, well, that's political and that's your view, and this is not something that we want to report in health news. But how do we enable readers and listeners to take action?
Yeah. Okay, and I'd like the Dr. Bell to comment on that too. Yeah, thanks.
So I'm going to give a very, great example from River State. So at the point where people realized that we're getting sick because of this, they took to the streets to protest. So there's a hashtag, Stop the Suit. And that was a call on the state government to go and get the people doing this and stop them from doing it. Of course, people in government benefit from that whole illegal refining. It's a lot of money, right? But then we're dying, we're getting sick every day, and you see it's on your high horses and you're doing nothing. So I know that, so both regular people in Port Harcourt, which is the capital of River State, took the campaign. It was huge on Twitter, for example, and they kept calling out the state government and calling out. Action has been taken because you helped them understand that the reason you're getting sick, you probably have an underlying health challenge, but this thing in the sky is worsening your situation. And so, would you rather die faster than you're meant to? Or, get some time off before you die? And I'm sure everyone wants to get a little time off to play around or do stuff before they die. So, everyone is on the street. Stop the suit, stop the suit. And interestingly, members of Rotary International in that state joined. And so it's a big campaign now. There's a whole conversation almost every other month about the suits, environment. So people are empowered. They know the importance of doing this thing. So beyond journalists writing and saying this is happening, because it looks like journalists are in some other bubble, different from what regular people are in. But people took to the streets. There was an online campaign, there's offline campaign, and the state government is doing stuff, because the last time I traveled and I called home as well, it's not as bad as it used to be, so there's action. And even until the federal level. So every day in the news you read the Navy confiscated number of barrels that were illegally moving to this direction and that. So that's action. And that's citizen-driven. The only thing journalists did was to say, this is happening, this is what's going on. And that was with the support of pulmonologists to say, there's a correlation. It may not be direct, but...
Yeah, correlation. But I think the question is, with Stop the Suit, it's kind of right next to the problem. This is where the extraction is happening, causing soot. What if the burning of fossil fuels is causing climate change and the impact is felt in a very different area? I think that was your question also, about how do we, should it be woven into each story, I guess you're asking? In other words, so we don't let that off the hook, okay. I guess. Right.
So if it's happening in a different area, I guess the way to get people to see why they need to take action is to place the possibilities, a projection, of course, and so an expert have to do that for you. Place the projection side by side what is happening with people who live with it. So if it's happening in River State, so even in River State there's that case. In Port Harcourt, it's more than in Bonny Island. But it keeps moving gradually. And so people in Bonny say, if people in Port Harcourt are dealing with this, we don't want this here. And so we have to start taking action. So, from my perspective, the best way to do is to present realities. This is what's happening here. Do you want this? Okay, do this. If you don't want this, do that. That's what I think.
You wanted to say, and I wanted to get your comment too. Yes.
Yeah, I would just give two examples. In Brazil, I've reported stories of two cities that have similar experiences of resistance against new exploitation of fossil fuels, because they had the realization that was damaging their health, because they had the experience of mining exploitation in the past decades that left traumas like water contamination, soil contamination, and radioactive waste. So we had like 2 small cities that were able to manage bills, not to explain the local policies, but they were very smart to managing in a local public policy a way of banning, prohibiting new exploitation of mining, coal, and fossil fuel plants. And this relation between this perception of health in these local communities and these plants, for me, makes the link not between health and climate disasters, but between health and an economic model, a development model. And I think focusing on the development model, when you talk about transition, it's a transition for a different development model. I think that's the key word that I use to not narrow the narrative to just carbon emissions, and to broaden that to those connections with health and adaptation and innovation.
Thank you very
Thank
much.
you.
I know I've wanted you to comment, but I also see this question has been burning. Could I ask you this question? Yes, thank you.
All right, I'll stand up because I'm little, so you can see me. Zorana Andersen, I'm epidemiologist, so I want to reflect some of I produce these nice studies with many millions of people, actually. In Denmark, we have amazing data. So reflection on 2 issues. One is, you brought it nicely, climate change, air pollution, environment, whatever we call it. I'm environmental epidemiologist, air pollution epidemiologist, climate change. We have made these separate issues that are all the same, equally affect us here now, and we have to break those barriers when we communicate. As you said, you found something in your nose today, and how does this affect climate later? We cannot separate it. We have to talk about immediate effects and long-term effects of things such as fossil fuel. Another one is, in some of our experiences, I work for European Respiratory Society, advocating for clean air in Europe for lung health and climate change. That some of the best stories are where we combine epidemiological evidence with personal stories. And that took me a long time to learn. I'm an epidemiologist, so I cannot choose one person's story. That's not science. That doesn't prove anything. But now that with air pollution advocacy, with case of Ella, the girl that died in London, that can happen in 2013 in European city from air pollution. We can tell that story and show face of disaster because we have all these fancy epidemiological studies that show exactly the same. And then when we come with credibility and a personal story, and that makes people understand much better, and sometimes touches the politicians' emotion, and that when things really happen, when it gets personal, is our experiences. But so we learn now in a lot of our science communication to politicians or public, we have epidemiological study, sum up, but we have a patient telling, but this is my experience. I live in Brussels. When I walk out, I do this and that. And a third final comment, I think WHO is preparing a repository of studies, and I really take your input to speed them up, because I see there's a need for that. And there are a number of studies coming now on climate change and air pollution interaction, a big exhaustion study, and we'll be talking about it, found that on hot days, people die more of air pollution effects because simply your lungs are hit by air pollution and humidity and heat. And so clearly we cannot separate this, and we'll see more research. So those are my points. Thank you.
Thank you for those wonderful points. Thank you. Questions in this room and online? Not yet. Okay. Thank you.
Yeah, I'm a physician. So I have a hard time to call my colleagues to act on climate change issue because medicine also contribute quite a bit for the greenhouse gas. So this is a very quite hard because for science, medicine is a science discipline. So we always from the analytical view that you have some you need to link the cause to the outcome, and then health outcome is the most final outcome as we see. But how to say as telling the story is individuals. It is the story. Story is very touching, but how to link this stuff together, it is not easy. Always I persuade that my colleagues that what you act is very important to how to reduce the carbon footprint. Such as the refugee Alan Kurdi, it is also due to climate change because of the drought in Syria. That we saw the story, it's very touching. But how to say that? It is because the climate change that we have this kind of disasters, so we have the refugees, so people die. This is a touching story, but how to persuade that what you do in your daily practices that will influence the outcome of the climate change. So this is, I don't know, do you have any experience of how to invite healthcare professional do more about reducing their climate impact.
Yes, I think
on
that
that,
I'd like
Doctor.
to hear. Yes, Doctor.
So it's a bit under 5% of greenhouse gas emissions come from the healthcare sector, and I think more people should have access to healthcare. So I think it should be bigger than that. But I'd say that, and so there's some significant decarbonisation challenges within healthcare. I have a cousin who works in anaesthetics. That is a particular challenge. If you're interested in some of the really difficult technical challenges of decarbonisation, healthcare is a really interesting space to be. But it's maybe not the first 5% I go for, pain relief. And so I think it is really important that healthcare sector steps up and says we're doing what, we're taking action. But they shouldn't see that as a barrier to also speaking out about bigger, harder, more urgent challenges. And I think there's quite a few people in healthcare. I'll often find we're talking about our climate and health program to some area of healthcare, and they go, I would do climate work, but I'm not net zero yet myself, and I feel like I can't. No, we all have to be, taking action ourselves while speaking out. We don't have time to wait until we're all perfect before we ask everyone else to take action. We're all in it together, losing while we're winning. We're in that position by the mid-2020s. We have to be, but also I just think we shouldn't let ourselves be limited in what we say, because yes, it's a bit under 5% of global greenhouse emissions, and it's important that we take action on it. But yeah, pain care relief isn't the first 5% I cut, and I think we should remember that. That's not to say it shouldn't be cut. It's that there are other more significant actors out there that we all need to be speaking out to.
Thank you very much. And that actually, I think we need to wrap up quite soon, but I can take one more question, I think. Yes.
Thank you so much. This is Manna from Egypt, a medical doctor and part of International Federation of Medical Students Association, IFMSA delegation. So my question is, how do you envision the role of media and health journalists in the surveillance and the prevention of the climate change related diseases? Thank you.
Thank you, Doctor. That's actually a question that I tried to ask, and it seems very difficult to answer, because, I mean, first of all, it seems that that's what health and climate journalists would want to do, that journalists should be doing, but how? Anybody care to? Doctor, you said earlier that anybody who knows how to do this is deluded.
People often have strong opinions about how to do climate comms. You've got to do it this way or that way. And no one knows, because we're still all making it up, and the context around us is changing. So anyone who tells you that they know exactly how to do climate comms is selling magic beans. They're snake oil salesmen. But that doesn't mean that we don't have good research that can help guide us. There is a growing area of social science research that can help give us an idea about what stories are most likely to be impactful. Many news agencies themselves will have data on their audiences. We can take an evidence-based approach to it, and we should where the evidence exists. But I think we just need to experiment and try lots of different things. I want to see climate and health journalism helping tell the story of what is happening out there to people, and help everyday people understand and see that connection that we heard from particularly, I think, when you were talking about at the beginning, there were lots of examples of sort of this thing is happening, but we need to be able to trace it out to say this is what's happening, tell that story, but also hold politicians to account. Particularly as I'm a policy person, you'd also be needing to do the political stories and saying, you're not doing this, you should be doing that.
Yeah, and just to say that, I mean, journalists uniquely have so much opportunity. Some journalists have to produce 2-3 stories a day, a story every day, or a major feature every week. It's an imperfect world. There are narrative stories, there are anecdotal stories, there is data, there's the call for data, there is getting to know the scientists to speak to. And we're also very pleased to see so many scientists, an epidemiologist, a pulmonologist, other doctors here interested in the subject, because we journalists need your voices. We also need civil society voices and, of course, the human story. It's not a perfect world, but we have many tools. We've discussed many tools already that we can string together to connect the dots on this important issue. Thank you so much to the online audience. Thank you to those who've joined us here. We really hope to continue this discussion every single day. Journalists have to tell this story all the time. Thank you.